This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about epidural hematoma. An extradural hemorrhage is bleeding between the inside of the skull and the outer covering of the brain called the dura. The picture on the right shows different types of intracranial bleedings. From left, epidural hematoma, on the right, subdural hematoma, and on the bottom, intracerebral hematoma. An extradural hemorrhage is often caused by a skull fracture during childhood or adolescence. This type of bleeding is more common in young people because the membrane covering the brain is not firmly attached to the skull as it is in older people. An extradural hemorrhage occurs when there is a rupture of a blood vessel, usually an artery, which then bleeds into the space between the dura mater and the skull. The affected vessels are torn by skull fractures. Rapid bleeding causes a collection of blood or hematoma that presents on the brain, causing a rapid increase in pressure inside of the head. This is called intracranial pressure increase. This pressure may result in additional brain injury, or pushing the brain towards the other side, or pushing the brain down through the brain stem. An extradural hemorrhage is an emergency because it may lead to permanent brain damage or death if left untreated. There may be rapid worsening within minutes to hours, from drowsiness to coma and death. A healthcare provider should be consulted for any head injury that results even in a brief loss of consciousness, or if there is any other symptoms after the head injury, even without the loss of consciousness. The typical pattern of symptoms that indicate an extradural hemorrhage is loss of consciousness, followed by alertness, then loss of consciousness again. But this pattern might not appear in all patients. The most important symptoms of an extradural hemorrhage are confusion, dizziness, drowsiness, or altered level of consciousness, and enlarged or different sized pupils, headache, head injury or trauma followed by loss of consciousness, then alertness, then loss of consciousness again, nausea and vomiting, weakness of one part of the body, usually the opposite side of the affected pupil. The symptoms usually occur within minutes to hours after the head injury and indicate an emergency situation. The neurological examination may indicate that a specific part of the brain is malfunctioning, for instance, a weakness of one side of the body or arm. If there is an increase in intracranial pressure, emergency surgery may be needed to relieve the pressure and prevent further brain injury. A head CT scan will confirm the diagnosis of an extradural hemorrhage and will pinpoint the exact location of the hematoma and any associated skull fractures. An extradural hemorrhage, or epidural hematoma, is an emergency condition. Treatment goals including taking measures to save the person's life, controlling symptoms, and minimizing or preventing permanent damage to the brain. Life support measures may be required. Emergency surgery is almost always necessary to reduce pressure within the brain. This may include drilling a small hole in the skull to relieve pressure and allow drainage of the blood from the brain. Large hematomas or solid blood clots may need to be removed through a larger opening in the skull called a craniotomy. Medications used in addition to surgery will vary according to the type and severity of the symptoms. Anticonvulsant medications such as Dilantin may be used to control or prevent seizures. Some medications called hyperosmotic agents like mannitol, glycerol, and hypertonic saline may be used to reduce brain swelling. Call your healthcare provider if symptoms persist after treatment, including memory loss, difficulty maintaining attention, dizziness, headache, anxiety, speech difficulties, and complete or partial loss of movement in one part of the body. Go to the emergency department or call 911 if emergency symptoms develop after treatment, including difficulty breathing, convulsions, seizures, decreased responsiveness or loss of consciousness, a different sized pupil, etc. For more videos like this video, please go to edxitvideo.com. But remember, these are educational videos and should never replace the attention or care from a medical provider. Again, my name is Dr. Carlo Ogier. I thank you for watching this video. But please take a minute to like my video and to subscribe to my channel.